So my genetic disorder is primary congenital hypothyroidism. So what is hypothyroidism? So it's congenital, this disease, which means it occurs from birth. And this is partial or complete loss of the thyroid gland function. Again, it affects infants from the time they're born, and the thyroid is absent, smaller in size, or it's in an abnormal location. So there's two types, and the one type is thyroid dysgenesis, which is the most common. It refers to the thyroid being absent, smaller in size, or in that wrong location, like in that last bullet point there. There's also thyroid dyshomogenesis, which is where the thyroid doesn't produce enough hormones or they're decreased. So the functions of the thyroid, what does the thyroid do? So thyroid is in charge of regulating and controlling many parts in our body, one of them being hormone control, specifically T3 and T4. So T3 is thiiodine thyronine, and then T4 is thrioxine, and these control the hormones that are secreted in our body, also control things such as growth, brain development, and our metabolism. The thyroid mainly regulates the energy in our body as well, and also helps us maintain our bone. So it's responsible for a lot of things. So if the thyroid isn't functioning properly, a lot of things can go wrong in the body. So what's the cause? The cause is a shortage of iodine, or the thyroid's inability to produce enough of these hormones, specifically T3 and T4, and then also gene mutations. So some physical effects that can occur from having this disease is the baby will, well, one, they're born pretty normal up until about several months after birth, and then they'll experience these side effects. So usually jaundice, constipation, low muscle tone, lower energy for a baby to normally have at the age that they're at, difficulty eating, swollen face or tongue, soft spots on the skull, and then usually a swollen stomach. So these can usually lead to intellectual disabilities as well, and then reduce growth rate if they're not found and treated. So the mode of inheritance, there's a few ways. So the one is autosomal recessive is the way that it's inherited. So which means that usually there's a carrier from the parent that passes it down. It usually can be passed from the mother as well, from either their diet or their low iodine as well. That could be passed to the baby and then affects their levels. From other syndromes sometimes, Pendred, Bamforth, Lazarus, brain lung thyroid syndrome, they can all lead to hypothyroidism in the baby. And then sometimes pituitary gland complications that eventually lead to hypothyroidism. Prevalence rate, so thyroid dysgenesis, which is when the thyroid is absent or smaller or abnormal. That's the most common case. It amounts for about 80% of all cases. It's more common in females as well as males. And then the genetic cause only accounts for about 15 to 20% of cases. There's also a higher rate seen in Asians. And then the incidence is also about 1 in 2,000 to 4,000 newborns. So it's pretty common. Some of the genes responsible, there's many responsible, but the main ones are PAX8, TSHR, which is thyroid stimulating hormone receptor, and then DuoX2. So when these genes are affected, the normal synthesis of the thyroid hormones that are produced is disrupted. So the genes that are involved in thyroid dysgenesis are mainly PAX8 and TSHR. They both play a role in controlling the growth and development of the thyroid gland. So when those are affected, so are all the levels in the body. The genes that are involved that aren't listed here that are usually involved in dyshomogenesis is DuoX8, SLC-SAS, TG, and then TPO. So then these ones will just disrupt the normal production of hormones as well. It's also important to note that most cases are sporadic for this disease. Even though some are autosomal recessive and inherited from the parents, some are sporadic. So some treatments, the synthetic hormones are a treatment. So what this does, it's usually a pill that is identical to the hormones that are produced in a normal functioning body. So the hormones that are usually produced from the thyroid that aren't happening when a patient has hypothyroidism, they'll be given a pill form and it just mimics that in the body. So this is usually levothyroxine, and this will have to be given all throughout life and as soon as the disease is found. So for life and every single day. Here is just the chart here. So you can just see how the children are affected in an autosomal recessive trait where a parent is a carrier compared to when they're not a carrier. So you can just see the probability in the children when someone's a carrier and when someone actually has the disease hypothyroidism. And then genetic testing done for this, there's usually two panels. So the one is hypothyroidism genetic panel, and then the other one is resistance to thyroid hormone panel, both testing for the same thing. There's many genes that are tested. There's over 22. And as you can see listed on that slide there, there's a few of them listed there. Some of those genes mentioned are the ones that were mentioned earlier, the PAX8, the TSHR, and then DUOX2. So some of the most common ones are tested for this disease. When this is tested, it can either be done through DNA, an oral swab, blood testing. There's a few ways that you could be tested for this disease. And there's no specific age, but usually early detection is important because you want to get on that hormone medicine as quick as possible so that your regulation of the body and your hormones are all regulated as quick as possible and you can start to feel better. So it's more of just a pill treatment. There's no really cure for hypothyroidism, but more of just kind of regulating your hormones and getting your levels back to normal. So the genes tested are listed there. And then again, early detection is important, but some implications to be aware of, there can be false positives or false negatives. So it is important to get tested a few times just to make sure that the results we're getting are correct. And then there's just some references. Any questions, feel free to leave them in the comments, but thanks for listening to my genetic disorder.